So first of all, yoga therapy is a self-regulating, complementary, integrative healthcare practice that can increase vagal tone. And these practices in yoga integrate both bottom-up, from the body to the brain, as well as top-down, brain to the body, neurocognitive mechanisms, facilitating the bidirectional communication between the brain and the body. So they're going to support integration. 80 to 90% of that vagal activity is sensory, from the body to the brain. So yoga therapy can contribute towards well-being in the face of pain, illness, addiction, disability, or mental illness, which are often outcomes of trauma. So in the yoga philosophy, we have these 8 limbs of yoga, which comprise ethics, physical postures or asanas, breathing practices, meditation, mindfulness, and more. Here's a little diagram, a complicated diagram, but you'll have access to this later, showing all the ways that the yoga can affect the nervous system and various parts of the brain. So yoga in general can help individuals regulate and balance their autonomic nervous system and glandular system. So it can be used as an intervention for depression, anxiety, PTSD, cancer, cardiovascular disease, insomnia, diabetes, and chronic pain. It's been found to improve well-being, mood, impulse control, and the functioning of the autonomic nervous system. And the frequency of continued yoga practice predicts a greater decrease in symptoms of PTSD and depression. And in some of the research, it suggests that 3 times a week is what's kind of required to make a big dent, 3 times a week of yoga practice as the minimum. So some of the bottom-up and top-down yoga processes would include, from the body to the brain, the postures, the movement in space, or proprioception, which engages your right hemisphere, the visceral compression and stretching, which then would activate the vagus in the GI tract, changes in heart rate, changes in respiration or breathing practices, balancing exercises stimulate the vestibular process in the inner ear, which stimulates the vagus, and enhanced interoception, and then chanting and vocalization turn on the vagus through the larynx and through the deepening of your breathing. And then top-down processes involved in yoga, and this would be from the brain to the body, include witnessing, mindful awareness, intention setting, visualization, imagery, concentration, mantra repetition, cognitive reframing, self-compassion, guided relaxation, moral observances, non-identification, devotion, surrender. So we can come at it from both directions. And there's a little bit more about interoception, but I'll go here. So how can we enhance interoception? We can enhance interoception through mindfulness, which means we increase our capacity to observe or notice or attend to internal and external experiences. So spend more time noticing. Number 2, describing. So an enhanced capacity for noting and labeling internal experiences, feelings, images, and thoughts. And we do that in compassion inquiry when we say, what sensations are you noticing right now? Can you describe that for me? Increased awareness, an enhanced capacity for acting with present-centered awareness rather than on automatic pilot. Instead of being lost in the past or in the future, we're here now. So that empathetic abiding presence is what we call it in compassion inquiry. And then number 4, non-judgment, an ability to take a non-evaluative, non-judgmental stance towards inner thoughts, images, and feelings and outer experiences, accept them as they are without making them mean a whole lot. And then number 5, non-reactivity, an ability to allow thoughts, images, and feelings to come and go without reacting to them or getting carried away by them. So when we bring the mindfulness piece into interoception, it enhances that substantially. And we can develop that through the practice of yoga as we can develop it through the practice of compassionate inquiry. Evidence supports the benefits of yoga for numerous health problems, stress reduction and improving debilitating pain, orthopedic problems such as back pain, knee pain, or other musculoskeletal illnesses, stomach pain, psychological illnesses such as anxiety and depression. And evidence supports the benefits of yoga for improving sleep, for improving cardiovascular disease, for improving diabetes, for decreasing inflammation, for improving inflammatory bowel disease, for improving immunological illnesses, for reducing the symptoms of PTSD in adult women, and for increasing the survival of patients with cancer. So now if we look at, we'll start by looking at some of the postures, the movements that might turn on the vagus. So one of them is inversions. Well, here they are. Inversions, forward bends, side bends, twists, heart openers, head turns, restorative postures, balancing postures, core strengthening postures, navel pumps, rhythmic rocking, bilateral movements, self-applied touch, sun salutation, and ear massage. So we'll go through now each of them a little bit. So one of them is inversions. So the inversions stimulate the baroreceptors in your carotid arteries. This could be something like shoulder stand or plow pose, where you pull the legs behind the head. So it helps to regulate blood pressure. So theoretically, this could bring someone from sympathetic to dorsal vagal or dorsal vagal into ventral vagal. Another one is a forward bend. So everybody stand up. We can all do a forward bend. And as you do the forward bend, add a little bit of interoception. So what you're feeling is the compression of your abdominal muscles. So stretch your arms up and inhale deep. And then exhale as you slowly come down and bring your belly and your chest towards your knees. And notice any compression in your belly. And one more time. Inhale up. Stretch up high. Now this is stretching the lungs. So that's increasing your vagal activity. One more time. Come down. Notice the compression in your belly. And good. Come sitting down again. So there's one exercise. I'm going to do lots, so just one at a time. But that's how it works. Okay, so I might as well stand up again. So here's another one. Is the side bend. So the side bend will open up your rib cage and your lung capacity. So the deeper you breathe, as long as you're breathing 5 or 6 breaths per minute, your vagus is going to turn on. So inhale as you bend to the left. Stretch the rib cage, bend far as you can. And then slowly exhale as you bend to the right. And one more. And feel into it. Notice what your body is feeling like as you do this. Deepen your breath. Stretch the rib cage, stretch the arm, and exhale to the other side. Okay, that feels good. Feeling relaxed already. Stay standing. So now we have, oh, I missed that one. There we go. So now we have a twist. So now this is going to compress your liver, your stomach, your abdominal organs. So inhale your arms out. You feel a little bit of, and exhale and twist to one side. Other side. Inhale left, exhale right. And do a few deep breaths so you can actually feel the compression of your abdominal organs as you twist. And then notice your lungs expanding, your lungs contracting. So really feel into it. Mindful movement is what we want. Perfect. You can relax. This next one I won't force you to do right now. But we can do this. Put your hands in your back, imaginary back pockets, and inhale, stretch back. Open your chest cavity, and exhale, back up standing. Again, inhale, stretch back, in and out through the nose. And exhale, standing, and one more time. Inhale, open your lungs, open, stretch your lungs. And exhale, stand up. Very good. And the next one, you can sit down for this one. So we did the neck roll before. Now we'll do a neck turn, just turning your neck. Why don't you place your hand on your carotid artery, feel your pulse in your neck. And this is the area that you are stimulating, the baroreceptors there, okay? And now, keeping in mind the feeling in your neck, just inhale your head to the left slowly. Imagine you're gently stimulating those baroreceptors, and exhale your head to the right. And at the same time, be aware of your head moving through space. So this sense of proprioception turns on your right hemisphere. And slow your breathing down. And one more time, inhale left. And exhale right. Next one, I don't think we can do in this room, but this would be a restorative posture. So in these restorative postures, we're encouraging deep breathing, deep relaxation, so very relaxing. So that's going to turn on the vagus. And one like this would also put pressure on the stomach and your intestines, activating the stretch receptors and the mechanoreceptors in these organs, which turn on your vagus nerve. So in theory, this could bring somebody from sympathetic or dorsal vagal into ventral vagal. Come standing up again. And surprise, surprise, here we go. Who can do it? So balancing exercises. So stand on one leg, one foot, and bend the opposite knee. You can have it at your ankle or your knee or your thigh, whatever works for you. And bring your palms together. Look straight ahead and see if you can balance. Whoops. See if you can balance. So this engages the vestibular system in your inner ear, which is needed for balance, which actually activates the vagus. Now do the other side. A couple slow breaths. And then relax. Okay, here's another one. So we call this one stretch pose. And it's the abdominal tone, right? Because you have to use your core muscles for this, which is going to put pressure on your abdominal organs, which is going to stimulate the vagus. But what we can do this another way, which is come sitting down. Come sitting down. And inhale through your nose. And hold the breath in and pump your belly in and out. Without breathing. You're just inhaling, hold the breath, and pump your belly in and out. I'm not breathing. And then exhale all the air through your nose. Hold it out. Inhale. Hold it in, pump. Exhale, hold it out. Pump. There you go. You can also do that one in this position. And if you're doing it in this position, you're also stretching the lungs. Interesting, eh? And then we have rhythmic rocking. All right, so we have to do this in a coordinated fashion. So place your hands on your thighs. And I'll have my arms above my head, but you can all have your hands on your thighs, or you can stretch them up. That might be more fun. So we're stretching the lungs. Everybody now, inhale this way. Yay! Exhale this way. Inhale. Exhale. A few more. Okay, inhale, stretch up, and exhale down. So this rocking could be side to side, could be back and forth, but just that gentle rocking reminds us of when we're being held as a young baby, and that rocking motion is very calming. The other thing that activates the vagus and can be very healing are these bilateral movements. I'm going to dare you to do this one. Okay. Oh, that's not it. Here we go. There we go. Okay, stand up. So simultaneous bilateral movements. So legs out, arms out, and then crisscross. Okay, so you can relax. So that's great because you're integrating both hemispheres of your brain, right? Top and bottom. It's like totally integrating with a bilateral movement, with a powerful breath. So one of the things that happens with the trauma is the corpus callosum, which is the divider between left and right hemispheres, can shrink. And so with that bilateral movement, we're increasing communication, left and right, that accentuates the healing from trauma. Also, self-applied touch. A calm, soothing touch can activate the vagus, so how about you stroke your arm? Just gently stroke one of your arms and tell yourself everything's okay. And then the other arm. So this self-applied touch can be another way to increase vagal tone. And for any of you that know the sun salutation, there's some research on the 5 minutes of sun salutations increases vagal tone. They activate the baroreceptors in the carotid sinus, do the movement of the neck and the up and down movement of the body, which alters blood pressure. They stretch the chest through the sequence, which increases lung capacity, deepens breathing, activates the vagus. And then the pressure on the abdomen during the forward fold in the cobra also will stimulate the vagus. Here's a fun one. So the ear, I'm going to show you the next slide first. So with your ear, this little flap here that's connected to your cheek is innervated by the vagus, so you can massage that. Just put your index fingers or your thumbs there, massage that little flap, that's stimulating your vagus. And the other area of the ear is not the outer part, but this part in here. It's called the concha. So you can put your thumbs in there, massage that, and that stimulates the vagus. So 45% of the tragus is innervated by the auricular branch of the vagus nerve, but the concha, that part on the inside, 100% of its fibers are coming from the auricular branch of the vagus nerve. Ear acupuncture can be very, very helpful for calming people down and is now used in PTSD because of the stimulation of some of these points. Okay, something else that can activate the vagus is sticking your tongue out. So everybody stick out your tongue and so now you're combining the breath with the tongue. Good. So that back third of your tongue is governed by the vagus, and things like gargling, gagging, or purring, any of those odd sounds we make, stimulates the mechanoreceptors at the back third of your tongue in the larynx and the vocal cords, innervated by the vagus.